Hi, my name is Heather, and I'm a cancer survivor. I was diagnosed with stage 2 invasive cervical cancer 11 years ago. According to the CDC, this cancer is the only gynecological cancer that has its own screening test, called the Pap smear. It also normally only occurs in women over the age of 30, and it's commonly caused by the human papillomavirus, or HPV, which is sexually transmitted. I, however, was only 28 when I was diagnosed, and I didn't have the common HPV virus that causes it. I also had a normal Pap just 7 months before diagnosis. To make things a little more complicated, I was also 36 weeks pregnant. At the time, I was already being seen at the University of Iowa hospitals and clinics because my daughter was diagnosed with spina bifida when I was only 28 weeks pregnant. Just the week before I was diagnosed, I was also admitted to St. Luke's Hospital because I had unusual bleeding. After running loads of tests, they couldn't figure out what was causing it, so I was sent home. A few days later, I went to the university for my normal 36-week check, and an intern that was examining me said something was wrong. After the doctor, the head of the department, and 2 oncologists examined me, I had had my first biopsy done. At the time, I was told it would be at least 3 days before I found out the results. But that night, I got a phone call, and the very next day, I was in oncology. After a lot of discussion about what was going to happen, they set it up that the next Wednesday, I would have a cone biopsy done, and that if that put me into labor, they were prepared to deliver my baby, seeing how she was 37 weeks at the time. My daughter had different plans, though, and 2 days later, I went into labor on my own. Having my daughter did set me back as far as treatment went. Because I had a cesarean, they had to wait at least 2 months to heal so that I could do the cone biopsy. After my cone biopsy was done, the results were not so good. My cancer margins had reached the limits, so I needed a full hysterectomy. A month after that, I began 6 weeks of daily radiation therapy, and 6 weeks every Monday for 8 hours a day I had chemotherapy. What I went through was not the normal common scenario for cervical cancer. I was only 28, I was pregnant, and I had my child before treatment could begin. Even though my case is different, my daughters and my son have all been treated with the Gardasil treatment to hopefully prevent the HPV virus. And I still encourage all women to get their yearly Pap smears because early detection is still the best. If they wouldn't have caught my cancer that day, and I would have still had my daughter 3 days after that vaginally, it would have been a death sentence for us both. The cancer cells would have spread to my bloodstream and to my daughter's as well because she had an open spine. I thank God every day that I am still here, and so is my daughter.